Hello, a frequently asked question for you today. Should the bladder be full before the embryo transfer? How much water should I drink to have full enough bladder before the procedure? When should I start drinking the water? How many hours before and at which speed? Is it better to be a little bit on the overfilled or less filled side? How many hours or minutes do I have to hold my urine after the embryo transfer takes place? Does it have any adverse effects on the rate of pregnancy if I empty my bladder right after the embryo transfer? If I can no longer hold it? We may produce tons of questions and feelings about from such a seemingly trivial but in reality a big issue of bladder fullness before and after the embryo transfer. Instead of answering all these questions, if I would tell you, no, you do not need to have a full bladder. Yes, this is possible. And if I say that before you are taken to the laboratory for the actual embryo transfer, our nurse will come to your room and ask you to go to the toilet and empty your bladder, as if you will have a routine gynecological examination. Over the years, I've heard from many of my patients how uncomfortable it is to insert the speculum while having a full bladder. Naturally, this is due to the fact that the limited space is further pressed and narrowed due to the anterior position of the bladder in the pelvis. Moreover, if the time passes from the start of the procedure until the embryo transfer, the kidneys work so hard that at the end of the embryo transfer, some patients are in excruciating pain. Asking them to go into the toilet is not always an option because either they empty all of their urine or cannot do a single drop due to the fear of letting all go and that the transfer will not be achieved or be suboptimal. It will eliminate all of these problems and provide convenience in a transfer procedure. As your bladder is empty afterwards, and it usually takes a maximum of 15-20 minutes, and then you will not need to go to the toilet while resting, and it will allow you to rest for as long as you want without getting up. More importantly, because it provides better imaging, I have been transferring embryos with an empty bladder using this instead of this. This is the usual method with an abdominal ultrasound probe with full bladder, and this is the embryo transfer I made while the bladder was empty with transvaginal ultrasound applied to the vagina directly with an empty bladder. The visibility and the resolution of the catheter containing embryos in it is superior in the second video done with a relatively new technique. In this way, all the questions and problems I have listed above disappear, and you can do this process without any stress, as there is no need for a preparation such as drinking water, checking if you have enough fullness, etc., with no pain and no coming and going back to the toilet. For IVF, egg donation, and self-egg treatments and other reproductive treatments in Northern Cyprus, you may contact directly via WhatsApp at this number, get free consultation, and plan your treatment with us. You may also subscribe to my YouTube channel to follow our results and videos. I wish you a happy and healthy day. See you soon. Bye-bye.